Factors influencing eating disorders among fashion models. In the world of fashion, the success of a model largely depends on the natural and physical beauty of her face and skin, but more importantly on her body weight. The media portrays the lifestyle of a fashion model as exciting, luxurious, and fulfilling, but this is not always the case. Models are at a higher risk of developing eating disorders such as anorexia nervosa and bulimia nervosa because within this particular profession, there is a greater emphasis on maintaining a thin physique. After all, fashion models are not hired for the proficiency in completing challenging tasks, but instead they are hired for the looks and thus are expected to maintain their appearance. In the 12-item General Health Questionnaire, GHQ-12, which is included in the 2007 London publication of the Journal of Positive Psychology, general distress and anxiety, as well as general dissatisfaction with life among models, is assessed. According to the authors of the Journal of Psychosomatic Research, as well as Matthew Hankins, a senior lecturer in public health at the University of Southampton in the United Kingdom, the GHQ-12 has been recommended as an easily administered and accurate screening tool for general non-psychotic psychiatric morbidity, and has been widely used and as a result translated into many languages and extensively validated in general and clinical populations worldwide. The results from the GHQ-12 show that the group consisting of 35 models between the ages of 18 and 35 scored higher in loss of confidence with 2.39 points than the group consisting of 40 same-aged but non-model participants who scored 1.98 points. As glamorous as the job of fashion model appears to be in the popular media, models are continuously dismissed by selective modeling agencies, especially since there are always younger and thinner girls to compete with. In addition, models are constantly degraded and subjected to humiliation, if not dismissed and replaced when they cannot fit into size 0 clothing, and the modeling agency must call on designers to alter the garments. According to a 2005 publication in the Journal of Contemporary Ethnography by two sociology professors, the most common criticism that models hear is that they are overweight, despite the fact that the average model at 5 feet 11 inches and 117 pounds is underweight relative to the average American woman who is 5 feet 4 inches and weighs 140 pounds. The professors then continued to write, "One occupational hazard of modeling is that everyone, clients, agents, hairstylists, photographers, makeup artists, and designers, feel entitled to make brutally pointed comments about models' physical deficiencies. Another is that this rejection is taken very personally because it challenges the model's conception of her own beauty. Disparaging remarks that can be construed as sexual harassment in most other job settings are taken as a given in the model's daily routine." With frequent rejection and criticism surrounding their work, models become more easily discouraged and insecure as well as dissatisfied with their physical appearance. They lose confidence in themselves and have lower self-esteem than average women and girls, as the GHQ-12 study shows. As a result, professional fashion models make it their primary focus to achieve an ultra-thin and lean body figure in order to avoid rejection and demeaning feedback. In order to stay relevant in this modeling business and maintain their career, young models take extreme measures to remain skinny. The Eating Disorder Examination (EDE), a 2002 interview conducted in Sardinia, Italy, by the authors of the academic journal Psychiatry Research, focuses on the symptoms of 55 fashion models between the ages of 60 and 34 and 110 girls within the same age range who suffer with eating disorders. According to the EDE, 10 models, 18.1%, and 8 controls, 7.2%, report important restrictive eating, and models were slightly more likely to report self-induced vomiting as a method to reduce calorie intake, 2% versus 1%. The EDE also found that more models than controls met the partial syndrome criteria for anorexia nervosa, 12.7% as against 3.6% among controls, and that one model out of 5, 21% as against 7% of controls, reported a heavy influence of body shape and weight on self-evaluation. According to the Academy of Eating Disorders, an organization that focuses on researching, educating, treating, preventing eating disorders, anorexia nervosa and bulimia nervosa are severe and often life-threatening mental illnesses that need immediate attention and treatment. Thus, taking such extreme measures in developing eating disorders can ultimately lead to death. A handful of models have fallen victim to such overwhelming pressure, one being 21-year-old Anna Caroline Reston. In 2006, the Brazilian beauty suffered and died from anorexia-related complications. At the time of her death, she was 5 feet and 8 inches tall, but weighed less than 90 pounds. The high risk of developing eating disorders that professional models face has been exacerbated by the shifting of cultural media trends from one that admires curvy women to one that now associates thinness with beauty, and obsesses over and popularizes skinny figure forms. In addition, the changes in a woman's traditional role from one that focuses on being a mother to one that is independent and career-oriented has worsened the problem. Furthermore, the preference of only ultra-thin models by well-known and reputable fashion designers and the fact that these designers ignore rather than encourage the enforcement of certain established rules and regulations on a model's body weight often prevents the problem from being solved. Society has held the idea that the perfect body consists of a thin and slender figure with less curves and flesh. As a result, a woman's body image, or the way in which she perceives her own body, is negatively affected because there is an increasing pressure for these young women to be underweight. According to the authors of an article published in the academic journal Eating Disorders, women face high levels of body dissatisfaction and eating disturbance because of the thin ideal internalization, in which an individual buys into socially defined ideals of attractiveness and engages in behaviors designed to approximate these ideals. The progression of this obsession over ultra-thin models and the slender physique is strongly influenced by media. Advertisements seen in television and popular fashion magazines portray only skinny models and celebrities, which sends a message to women that beauty, success, personal happiness, self-worth, and being loved are all based on having a thin shape. As a result, style and beauty magazines have been identified as the prime source and disseminator of inordinately thin ideals for women. Replacing slender fashion models and celebrities as role models for beauty, attractiveness, and success, magazines are given average women and girls a standard to follow and hint that women everywhere in the world share a single common concern and are united by an inescapable bond of beauty. As a result, women and girls begin comparing themselves to fashion models who are perceived as superior, all because these models are featured in advertisements. This only leads average women and girls to grow increasingly dissatisfied with their own body image and yearn for what they do not have, which is the unhealthy slim body figure of models. In a 2010 published survey conducted by the authors of the academic journal Psychology of Women Quarterly, 46% of the 50 undergraduate German women participants chose a diet snack as opposed to a normal snack after viewing advertisements that featured thin models. The finding points to the pervasive and influential role of media in triggering restrained eating. The images displayed by the media have detrimental psychological effects on women and girls who want nothing more but to fit society's standard of beautiful, and few attempts have been made to enact change in the media to prevent this effect. As a result, popular media and magazines have put little effort in portraying models who are average size, especially since society is so obsessed with exclusively underweight models.